So we are going over the popular topic amongst women, and that's menopause. Now, I'm not in menopause phase, so I don't exactly know how intense the symptoms are, but from watching my friends who are going through it, I definitely want to avoid it. But technically, I should be going through it because I'm in my 30s, right? Premenopause.
So it's possible, because perimenopause can start as early as 35. It can, yeah. And, you know, women may go through early symptoms of perimenopause into menopause. Some women, menopausal symptoms can last 15 years, some 5 years. Again, it depends on the person, on the woman. It's a process, right? Just, you know, if you think of puberty, right? As we went through puberty, that was a process. That took a few years, you know, as women developed and as then, you know, the menses came. That's a process. Well, it's kind of the process backwards. Yeah.
Dang, but some people skip it. How do you explain that?
I know, lucky girls.
Yeah.
Well, one of the things I say to my patients is, if you can, check with your mom and check with your grandma.
Really?
And check with your aunties and see what their symptoms were. Because I have seen some links to, you know, what the symptoms are of the woman in front of me versus and the symptoms that her mother had or her grandmother had or her aunts have or her sisters have. Some women do skip through it. They don't notice it. There's a lot of factors that can explain that. One, it depends. Check also, I ask women to check, and I check actually in the office, you know, do you have PMS symptoms? Do you have uncomfortable menstrual symptoms? Do you suffer from seasonal affective disorder? If they're going check, 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 then hormonally something, you know, is way off balance. So the tendency for them to have uncomfortable menopausal symptoms is greater. The women who will not have any menopausal symptoms, you know, I have found not a big PMS symptom, not big menses symptoms. So somehow the hormones are more imbalanced.
Whoa, I have a chance.
We all have a chance, Bev. We all have a chance. Because with homeopathy, it's brilliant. It's just, I know that doesn't sound very scientific, but it truly is in helping women balance their hormones. Yeah, with some there may be some work, some dietary considerations. We're back to getting off sugar and white things like white flour, white rice, processed food. Those things can really increase the hormones in the body. But, you know, if those are reduced, we get some good homeopathic treatment in there. It's great what can occur.
So is it mainly like the remedies working more on the immune system?
It can work on the immune system, yes, but it also works on the hormonal system, okay? Because that's really what drives menopausal symptoms, yeah? Yeah.
Oh. Now, since these symptoms can happen immediately, can the remedies take effect just as fast?
Immediately. We all want immediate, right? Yeah, okay.
Just like labor.
Yeah, immediate. So there's a couple things that I do in treatment. And so I'll explain to a woman that, for example, I use hot flashes. So when those hot flashes come, our goal is obviously to reduce the frequency and the intensity of the hot flashes.
Right.
So I have to work sort of at what we call a chronic level. Okay, I have to rebuild the hormones, get them balanced first. Well, that doesn't always happen immediately. Sorry to say, folks. However, I do have an answer for that. So as that's getting rebalanced, there may be some situations where, you know, hot flashes are still occurring. So what I will do then is offer a homeopathic treatment for that acute manifestation of hot flashes. So we're still working chronically, but then I can offer some support to reduce that acute intensity, let's say, of the hot flash. So to give her some comfort during those times.
Gotcha, double whammy.
Double whammy.
Nice.
But over, the goal is that we're reducing the acute homeopathic medicine
at the same time,
because chronically we're making a difference. Yeah.
What results have you seen in your practice?
Wow. Hot flashes reduced anywhere between 60 to 100% for many women that I treat. Mood is a big one. Mood changes. So, moods are more balanced, less irritability. Another one, hair loss can be a symptom. So, the hair stops shedding, the skin is not as dry, for example. So, wide variety, yeah.
Now, if people were to take, or women were to take these homeopathic remedies to try to prevent menopause, can that work, or do you have to kind of take it as it comes?
That's a good question, actually. I'm going to answer that two ways.
Okay.
The first way is, if it's not broken, don't fix it. Yeah?
Got you. Okay.
Yeah?
Fair.
However, good homeopathic treatment in the long run will prevent so many different upcoming health issues, menopause being one of them. So if you're under the care of a good homeopathic practitioner, you are already in such balance that those things will not be an issue.
Good point.
Yeah.
Good point.
I thought so.
Well, thank you so much for that. Like, I know a lot of herbal formulas out there that help, but it is a hit and miss. So it's really good that you kind of customize your approach to the woman's situation. Because I can imagine not all women are getting all the same remedies here.
No, they're not. They're not. It's very customized. It's very individual. And I think, herbally, a lot of women do experience benefits from a variety of things that they may purchase. And thank goodness that helps them. But many don't, and that's why I think good homeopathic, individualized treatment makes a big difference.
Thank you.
You're welcome.
And that's Lisa DeCandia.
Bye for now.